Did you know there are three delicious fruits that don't just avoid raising your blood sugar? They actually help lower it? Most diabetics are told to stay away from sweet fruits, but recent research reveals something surprising. Certain fruits contain unique compounds that act like natural blood sugar regulators. One of them improves insulin sensitivity by up to 25%. Another reduces glucose spikes by slowing down the same enzymes that diabetes drugs target. And the third, often misunderstood, actually helps repair nerve damage and boost collagen for your skin. They support your heart, kidneys, digestion, immunity, and vision, all while tasting like nature's dessert. In today's video, we'll uncover the three best fruits every diabetic should eat and how to prepare each one for maximum healing with the right portion and timing. And yes, you'll even get one blood sugar-friendly recipe for each. First on list, apricots. Apricots may look like soft, innocent fruits with their golden orange glow, but for diabetics, they can quietly become one of the most healing, glucose-friendly foods on the plate. Their glycemic index is just 34, and their glycemic load per serving remains below 4, which means apricots release their sugars slowly and steadily, supporting smoother blood sugar curves instead of sharp spikes. This makes them incredibly valuable for both type 1 and type 2 diabetics, especially when managing post-meal glucose or fasting blood sugar. One fresh apricot weighs about 35 grams and contains just 17 calories, 3.9 grams of natural sugar, and nearly zero point 0.7 grams of dietary fiber, a rare low-sugar, high-antioxidant combo in the fruit world. Eat 2 fresh apricots together, around 70 grams, and you get approximately 34% of the daily value for vitamin A, 16% for vitamin C, 6% for potassium, and over 8% for fiber, along with trace minerals like iron, copper, and magnesium, all of which quietly target the root complications of diabetes. Let's start with how apricots affect blood sugar and insulin control. Apricots are rich in soluble fiber, especially a compound called pectin, which slows carbohydrate digestion and glucose absorption in the small intestine. This helps to flatten the blood sugar curve after meals and may lower insulin resistance, especially in people with early-stage type 2 diabetes or prediabetes. One recent study found that consuming moderate fiber fruits like apricots can improve insulin sensitivity by up to 15% over 8 weeks, helping lower both A1C and fasting glucose. Beyond just blood sugar, apricots deeply support the pancreas, which produces insulin. Their antioxidants, particularly chlorogenic acid, quercetin, and catechins, help protect the beta cells of the pancreas from oxidative stress and inflammation, giving insulin-producing cells a better chance of staying active and functional. When it comes to diabetic nerve damage, also known as diabetic neuropathy, apricots offer gentle but meaningful protection. Their combination of vitamin E, carotenoids, and polyphenols works at the cellular level to reduce oxidative damage to nerve endings, helping relieve symptoms like burning, numbness, and tingling. These same antioxidants also calm inflammation in peripheral nerves and improve vascular circulation, which is critical for restoring proper nerve function over time. One of the standout strengths of apricots is their ability to protect and strengthen the heart and blood vessels, a vital need for every diabetic. The potassium found in apricots helps regulate blood pressure by relaxing blood vessels and balancing out the effects of sodium. The soluble fiber in apricots can lower LDL cholesterol by trapping it in the digestive tract and flushing it out. Meanwhile, their rich polyphenol content, especially catechins and chlorogenic acid, reduces inflammation in the arteries, lowers oxidative stress in blood vessel linings, and improves endothelial function, which is the ability of blood vessels to expand and contract normally. This matters deeply for diabetics, as endothelial dysfunction is a major cause of diabetic heart disease. Over time, regularly eating antioxidant-rich fruits like apricots may reduce the risk of atherosclerosis, heart attack, and poor circulation, while improving overall blood flow to the brain, extremities, and vital organs. Apricots also shine when it comes to eye health, especially in protecting against diabetic retinopathy and macular degeneration. Thanks to their high content of beta-carotene, which converts into vitamin A, apricots help maintain the health of the retina, the light-sensitive tissue at the back of the eye, that's often damaged in diabetics due to high glucose and poor circulation. Vitamin A is essential for night vision and preventing dry eyes, while lutein and zeaxanthin in the skin of the fruit further protect the macula from oxidative damage and UV light exposure. In fact, regular intake of vitamin A-rich fruits like apricots may reduce the risk of vision loss in diabetics by over 30%, according to one observational study. Let's also talk about kidney health, another silent area where diabetes often takes its toll. Apricots provide a modest but consistent amount of potassium, which helps balance sodium levels and regulate fluid pressure in the kidneys. This can reduce strain on the kidneys and support the body's natural filtration system, which is often overworked in diabetics. Additionally, the alkaline nature of apricots may help balance urinary pH, reducing kidney stone risk and protecting delicate nephrons, the tiny filtration units that can be damaged by chronic high blood sugar. Their impact on gut and digestive health is just as impressive. The natural fibers in apricots act as a prebiotic, feeding healthy gut bacteria and supporting smoother bowel movements. Many diabetics suffer from gastroparesis or slow digestion. Apricots, when eaten in moderation, can gently stimulate intestinal movement without causing bloating or spikes in blood sugar. Plus, their water content supports hydration, and their mild natural acids assist in enzymatic digestion, which can reduce bloating, cramping, or constipation often seen in poorly controlled diabetes. On the immune system side, apricots offer a rich dose of vitamin C and polyphenols, which support the activity of white blood cells and reduce systemic inflammation. This helps protect diabetics from slow wound healing and frequent infections, including urinary tract infections and gum inflammation. On the skin health front, the vitamin A and C combo helps with collagen production, wound healing, and regeneration of damaged skin tissue. This is especially important for diabetics who often struggle with slow skin repair or dry, cracked skin on the feet and hands. Here's a fun fact you might not know. Most of the antioxidant power of an apricot is concentrated in its skin, more than 50% in fact. So skipping the peel means missing out on much of its nerve, heart, and eye-protecting compounds. Another surprising insight, fresh apricots contain twice the vitamin C of dried apricots, but dried versions have more potassium and fiber by weight. Both are useful for diabetics, but fresh is better when blood sugar control is your main focus. Let's clear up a common myth. Apricots are too sweet for diabetics. This is misleading. Although apricots are sweet-tasting, their total sugar per fruit is under 4 grams, and their fiber slows absorption. In reality, apricots are one of the few naturally sweet fruits that are low GI, low calorie, and high in antioxidant density, a rare and helpful combination for blood sugar control. Looking for a delicious way to add apricots to your day? Try this simple, gut-friendly apricot compote. Slice 2 fresh apricots, about 70 grams, add to a saucepan with a 1/4 cup of water, a pinch of cinnamon, and 1 to 2 chopped walnuts. Simmer for 6 to 8 minutes until softened, then let cool. Spoon this over plain Greek yogurt or a small portion of overnight oats. This recipe supports blood sugar balance, digestion, nerve repair, and immune function. Portion guide. 2 fresh apricots per serving is ideal for most diabetics. And the best time to eat this fruit? Mid-morning between meals or post-lunch for smoother glucose response. Here's something important to keep in mind. Avoid sulfite-treated dried apricots, especially if you have asthma or chemical sensitivity. Sulfites can trigger inflammation and cause digestive upset in sensitive individuals. If using dried apricots, choose unsweetened, organic, and sulfur-free options, and limit to 2 to 3 halves per serving to keep the sugar load safe. Before we go to the next fruit, where are you watching from? Drop your city or country in the comments. It's always inspiring to see how far this healing video is reaching across the world. Second on list, strawberries, bright, juicy, and naturally sweet. Strawberries may look like indulgent treats, but for diabetics, they're one of the most powerful healing fruits you can eat. Despite their sweetness, strawberries have a low glycemic index of just 41 and a glycemic load of only 3 per 1/2 cup, making them one of the safest fruits for blood sugar control. Even more impressive is how they actively lower post-meal glucose spikes, reduce inflammation, and protect nearly every major organ affected by diabetes, including the heart, skin, kidneys, eyes, nerves, and immune system. 1.5 cup serving, about 75 grams or 4 to 5 medium strawberries, contains just 25 calories, 1.5 grams of fiber, and 4 grams of natural sugar, but delivers a powerful 72% of the daily value for vitamin C, along with 5% for folate, 3% for potassium, and small but impactful amounts of magnesium, manganese, and polyphenols. Let's begin with blood sugar and insulin. Most people don't realize that strawberries contain natural compounds that inhibit the same enzymes, alpha amylase and alpha glucosidase, that are targeted by diabetes medications like Apricots. This means strawberries naturally block the breakdown of carbohydrates into glucose, helping the body absorb sugars more slowly and with less impact on insulin levels. In fact, research shows that strawberries can increase insulin sensitivity by 25% when eaten alongside high-carb meals, thanks to the anthocyanins, the deep red pigments that make them vibrant and potent. In one study, adults who consumed strawberries with white bread had significantly lower post-meal glucose compared to those who didn't. Here's a powerful tip many diabetics overlook. Eating strawberries before or with a starchy meal, like bread, pasta, or rice, can actually reduce the resulting blood sugar spike by up to 36%. Their fiber and polyphenols act like a natural blood sugar shield, making strawberries an ideal first bite fruit before a high glycemic dish. Now let's talk about heart health. Diabetics face a much higher risk of heart attacks, stroke, and circulation problems. But strawberries offer layered cardiovascular support. Their combination of vitamin C, potassium, and ellagic acid reduces LDL cholesterol, supports healthy blood pressure, and protects artery linings from inflammation and oxidative damage. The anthocyanins in strawberries also improve endothelial function, helping blood vessels dilate properly, which improves circulation to the brain, heart, kidneys, and extremities. Long-term strawberry intake has even been linked to a 19% reduction in heart attack risk, particularly in women with high blood sugar. Strawberries also support the immune system, which is often weakened in people with diabetes. Their high vitamin C content supercharges the activity of white blood cells, helping the body fight infections and heal wounds faster. Inflammation-related conditions, such as gum disease, UTIs, or skin ulcers, may also heal more efficiently when antioxidant-rich fruits like strawberries are eaten regularly. Speaking of skin, this red berry offers excellent protection against diabetic skin breakdown. The powerful combination of vitamin C, ellagic acid, and flavonoids in strawberries helps stimulate collagen production, improve skin elasticity, and speed up wound healing. For diabetics who struggle with dry skin, foot ulcers, or cracked heels, strawberries may help reinforce skin repair from the inside out. Their impact on kidney health is also worth noting. Strawberries contain alkalizing minerals that help reduce the acid load in the body, lightening the workload on the kidneys. Their anti-inflammatory polyphenols protect blood vessels that feed the kidneys, and the moderate potassium content helps balance sodium levels without overloading the system. When consumed regularly, strawberries may help slow the progression of diabetic nephropathy, especially when combined with a low-sodium, antioxidant-rich diet. One fascinating benefit most people never think about: the tiny seeds on the outside of a strawberry, more than 200 per fruit, contain unique plant fibers and ellagic acid that support digestion, gut repair, and metabolic regulation. These seeds gently feed the beneficial bacteria in the colon, reducing inflammation and strengthening the gut lining, which is often impaired in people with type 2 diabetes or metabolic syndrome. This means the entire fruit, from pulp to peel to seed, plays a role in healing. And here's a surprising insight that makes strawberries even more accessible year-round. Frozen strawberries are nearly just as powerful as fresh ones. Research shows that frozen strawberries retain over 90% of their vitamin C and antioxidants, making them a cost-effective, long-lasting option that still supports blood sugar and inflammation when fresh berries aren't in season. Just make sure they're unsweetened and additive-free. In terms of nerve protection, strawberries are rich in fisetin, a rare antioxidant that helps shield neurons from high blood sugar damage. Fisetin has shown neuroprotective effects in lab studies, improving memory, reducing inflammation, and supporting better sensory nerve function. This may offer relief for early symptoms of diabetic neuropathy, including tingling or numbness in the hands or feet. Let's address a common myth. Strawberries are too sweet to be safe for diabetics. While they taste sweet, strawberries contain less sugar per cup than an apple or orange, and the sugar is tightly bound to fiber and polyphenols. This slows down absorption and prevents glucose spikes, making them not only safe, but smart for diabetics when portioned correctly. Here's a fun fact that surprises most people. Strawberries contain more vitamin C per gram than oranges, and that vitamin C helps protect the retina from oxidative damage in diabetic retinopathy. Regular strawberry intake may support vision health by improving capillary strength in the eyes, reducing fluid leakage, and protecting night vision. If you want to enjoy strawberries in the most diabetic-friendly way, here's a simple healing recipe. Slice 1/2 cup of fresh or thawed frozen strawberries and serve them over plain Greek yogurt with 1 tablespoon ground flax seeds and a sprinkle of cinnamon. This combo supports blood sugar balance, skin regeneration, digestion, and insulin sensitivity. Portion size, 1/2 to 3/4 cup per day, about 4 to 6 medium strawberries, is ideal. And the best time to eat them? Mid-morning or as a pre-meal snack before lunch or dinner, especially if you're eating a starchy dish. One helpful tip: always choose organic strawberries if possible. Strawberries rank among the most pesticide-contaminated fruits, and many of these chemical residues can worsen inflammation in sensitive individuals. If organic isn't available, wash them thoroughly with a solution of baking soda and water to reduce surface toxins. Third on list, peaches. Soft, fragrant, and naturally juicy, peaches are often mistaken for high-sugar fruits that diabetics should avoid. But the truth is, when eaten fresh and in the right portion, peaches can become a gentle, healing tool for blood sugar control, gut repair, nerve health, and even collagen production. With a glycemic index of just 42 and a glycemic load of around 5 per medium peach, this fruit releases its sugars gradually, minimizing glucose spikes. One medium-sized peach, about 150 grams, contains 58 calories, 2 grams of fiber, 14 grams of natural sugar, and over 10% of the daily value for vitamin C, 8% for vitamin A, and 6% for potassium, along with trace minerals like magnesium, phosphorus, and antioxidants like chlorogenic acid and lutein. Let's start with blood sugar and insulin. Peaches contain a class of compounds known as phenolic acids, particularly chlorogenic acid, which helps slow glucose absorption in the intestine, reduce inflammation in fat cells, and improve insulin sensitivity. In one study, peach extracts reduced post-meal blood sugar spikes and helped balance insulin levels in those with prediabetes. The fiber content, especially the mix of soluble and insoluble types, delays carbohydrate digestion and feeds beneficial gut bacteria that regulate glucose and appetite hormones. When eaten in moderation, peaches may help lower fasting glucose and improve insulin's effectiveness over time. For heart health, peaches provide a blend of potassium, vitamin C, and plant polyphenols that reduce arterial inflammation, support smoother blood flow, and lower the risk of hypertension, a major concern for diabetics. Potassium helps balance out sodium and regulate blood pressure, while the flavonoids in peach skin protect the inner lining of blood vessels known as the endothelium. When this lining is damaged by sugar or oxidative stress, it becomes stiff and narrow, reducing oxygen to the heart. Peaches help keep those vessels flexible and oxygen-rich. Peaches also support kidney health, particularly for diabetics facing early signs of nephropathy. Their moderate potassium and fluid-rich content support healthy hydration and filtration, while their low sodium and alkaline-forming nature reduce the strain on kidney tissues. The antioxidants in peaches have been shown to decrease the oxidative load on kidney cells, offering mild but steady protection over time. Now let's look at their impact on nerve repair and neuropathy. Diabetics often suffer from tingling, burning, or numbness due to damaged peripheral nerves. Peaches offer anti-inflammatory and neuroprotective compounds like caffeic acid and lutein that support nerve regeneration and reduce pain signals. Plus, their fiber indirectly supports nerve health by reducing glycemic volatility, which is a key cause of nerve injury in diabetics. Peaches are also excellent for gut and digestive health. Their soft, soluble fibers help slow digestion and prevent blood sugar crashes, while their gentle acidity helps stimulate bile and pancreatic enzymes, useful for diabetics with sluggish digestion. A healthy gut microbiome is closely tied to glucose control, and the prebiotic fibers in peaches help feed friendly gut bacteria like bifidobacteria, reducing inflammation and enhancing nutrient absorption. When it comes to eye health, peaches offer a solid dose of beta-carotene, a vitamin A precursor essential for protecting the retina and macula. The lutein and zeaxanthin in peach skin also help filter blue light and reduce oxidative stress on the eyes, slowing the progression of diabetic retinopathy and macular degeneration. Regular peach consumption, paired with other low GI fruits, can help preserve night vision and capillary strength in the retina. On the immune system front, peaches provide vitamin C and natural antibacterial compounds, which support the production of white blood cells and reduce chronic inflammation. This can help diabetics fight off infections faster, especially skin wounds, gum disease, and urinary tract infections. Speaking of skin, peaches are one of the best fruits for collagen support. Their vitamin C boosts collagen formation, while beta-carotene helps reduce inflammation that contributes to skin thinning or cracking, particularly in the feet and hands. Here's a myth many people believe. Peaches are too sugary for people with diabetes. In reality, while a peach may taste sweet, its natural sugars are paired with fiber, water, and antioxidants, all of which slow down absorption. Unlike refined sugar, the fructose in peaches enters the bloodstream gradually, giving you energy without a spike. Now, for a unique insight most don't know, the fuzzy peach skin is packed with more antioxidants than the flesh itself. That's right, those soft, slightly bitter compounds in the peel contain concentrated polyphenols and carotenoids that reduce blood vessel inflammation, ease nerve stress, and even help repair DNA damage caused by high blood sugar. So don't peel your peaches unless absolutely necessary. Here's another surprising tip. Grilling peaches can increase their antioxidant power by breaking down cell walls, making certain polyphenols more available to the body. Try this healing recipe. Slice one medium peach, grill it lightly for 2 to 3 minutes per side, then drizzle with a teaspoon of almond butter, a pinch of cinnamon, and top with crushed walnuts. This dessert supports blood sugar control, improves gut function, and helps repair collagen and nerves. Portion guide: one medium peach, around 150 grams, is perfect. And the best time to eat? After lunch or as an evening snack before dinner to satisfy sweet cravings without glucose spikes. A gentle precaution: avoid canned peaches in heavy syrup or juices, as they often contain added sugars and preservatives that can spike blood sugar and stress the kidneys. Always choose fresh, firm, and seasonal peaches, or go for frozen, unsweetened slices when fresh ones aren't available. So if you're ready to transform the way you see diabetes nutrition, one bite at a time, make sure to like this video, subscribe, and tap the bell. Because this journey to healing is just getting started, and the next step may be even sweeter than the last.